Hello, everyone. Welcome to the July session of the Next Generation Speaker Series. It's really exciting to have you all here today. We are going to go ahead and get started with our presentation for today. I'm really excited to welcome Elizabeth Rojo here, who will be presenting. She is a doctoral student specializing in the intersection of climate change and social determinants of health, with a current focus on heat health impacts within the U.S. farm worker community. She co-leads the Climate X PopHealth working group within Duke University's Department of Population Health Sciences and serves on the Environment Section scientific team within the American Public Health Association. So thank you so much for being here today, Elizabeth. I will let you go ahead, share your slides and take it away. And then I'll say, for any attendees, please, if you can turn your camera on, that would be really fantastic. And then if you could also introduce yourselves in the chat so we know where everyone's calling in from today, that would be great. But thank you, Elizabeth, and go ahead.
Thank you. Thanks for the invitation. I'm very excited to be here. I'm going to share my slides, and please let me know if you can see them.
Yes, looks good.
Yes. Okay, perfect. All right. So I'm going to be presenting a topic that's very close to me, and I'm very passionate about, and it's also very relevant. I'm presenting from North Carolina, so we're in the middle of the heat season. And so we're experiencing a lot of heat waves very early on into the summer, and also a very relevant topic around this community in terms of immigration, that it all ties in, and we're going to be able to talk a little bit more about it. So, U.S. farm worker communities navigating extreme weather challenges. And I came across this visual that I really, really liked, and I think it makes it really easy to see the difference in how One Health, planetary health, climate and health all overlaps, and how it differentiates too. So I'm here today as a climate and health researcher. Um, and so I'm going to start with just highlighting a little bit of the total disasters by event type for two different periods, a 20-year periods. And this was from a UN report. We see that the main disaster events have been floods and storms, and they continues to stay significantly growing at the same speed. But when we do the calculations in terms of how much the frequency of these events grew, we see that extreme temperature grew by over 200% during this period. And so I'm going to focus a little bit more on extreme temperature, mostly on heat. So for here, extreme temperature can mean either extreme cold or extreme heat. So I'm going to focus on extreme heat. Um, and then within the farm worker community, I'm going to explore a little bit more on extreme heat and wildfire exposure. And so, as you all may know, climate change impacts us unequally. And so, the groups that are usually the most affected are underserved populations with health disparities. They include communities of color, low-income populations, low educational attainment groups, immigrant groups, indigenous groups. And also exposed workers. This is mostly outdoor workers, and it includes farm workers, construction workers, landscape workers, um, persons with disabilities. There's also an increased vulnerability by life stages, fetal, prenatal, or infants, young children, pregnant women, and the elderly. There's also increased vulnerability associated with chronic medical conditions like diabetes, asthma, cardiovascular diseases, and psychiatric diseases. And populations in low middle income countries also already experience higher rates of existing disease, malnutrition, and extreme poverty. So climate change will continue impacting these groups. And so I'm going to focus on farm workers under the exposed workers group. So farm workers are essential workers and the backbone of our agricultural industry. A little intro to the U.S. farm worker community. So there's approximately 2.5 million farm workers across the United States. Although it is very difficult to collect accurate data on farm workers due to constant mobility, language and culture barriers, or privacy concerns, they can be considered a hard to reach population. So most of these data that we get is through smaller studies. So it gives us a bit of a picture as to who the farm worker community is, but we are still missing a lot of farm workers. Most of our farm workers are foreign-born workers, so about 68% of the total workforce are foreign-born. Approximately 40% are unauthorized workers. Approximately 15% are migrant workers. And what I mean by migrant workers, they are defined as those farm workers who are required to be away from their community, from their place of residence to conduct agricultural work within at least 24 months. So within a 2-year period, they go to perform agricultural labor, and so they're considered migrant workers. They can move from state to state, or they come from a different country. Approximately 30 to 80,000, and that's a huge gap, are children farm workers, again, because children farm workers are an even more vulnerable group and harder to count. Approximately 34 of them are women, and they are vulnerable to sexual harassment and sexual violence because they are a minority in the group. Um, Most of them are low income. They have high level of poverty and they have low wages. Most of them earn a piece pay rate, which means that they get paid by the buckets or by the boxes that they harvest, instead of by the hour. And so, because of this pay system, they are also more vulnerable to continuous exposure to environmental hazards, to heat, because when they take a break, that means that they're not earning money. They also have a limited education. Their education and literacy is limited. Most of them have less than a high school diploma or the equivalent. And there's also cultural and language differences within the farm worker community, although most are Latino and most identify as Spanish speaking and Mexican born. We're seeing a little bit of a shift, at least in North Carolina, where I do most of my research with the farm worker community. We're seeing a change with more people speaking indigenous languages and also Creole. Approximately 10% of the total farm worker community speak an indigenous language and have very limited Spanish knowledge. So this is important because as we are thinking about interventions and programs, we also need to take this into account in how we're communicating this to communities. If we assume that English and Spanish should be sufficient, that might not be the case. And then these states are the states that have the highest populations of farm workers, starting California being the one with the most farm workers, and then Texas, Washington, Florida, Oregon, and then North Carolina. So North Carolina is 6th in the nation with the highest farm worker population. And so you might ask why so many are foreign born and Mexican born. So this was done by design. So in the 1940s, and the program, the Bracero program, began. It was a diplomatic accords between Mexico and the United States. It allowed millions of Mexican men to work legally in the United States on short-term labor contracts. It brought up more than 4 million braceros to work in U.S. agriculture, and this was to address agricultural labor shortage during World War II. Bracero in Spanish, it's a play on the word brazos, arms, so they needed more arms to help with agricultural labor. And so this program was terminated in the mid 60s, and then it was later brought back, but with a different name and revamped. So it's the H-2A visa program, which was created in the 1986. Sorry, in 1986. And again, there was not enough domestic workers to keep up with agricultural labor, and so this program started. The Temporary Agricultural Workers Program is a guest worker initiative for seasonal jobs. It's also employer sponsored. and more than 90% of H-2A visa workers are from Mexico. The employer is required to provide housing, transportation, and meals. And this is really important, especially as we're talking about heat and heat protections. Housing, making sure that housing has AC or a cooling mechanism for farm workers, which we find that there are several violations. There's been studies that housing have violations on that front. And so what are some challenges in the farm worker community? So they lack worker protections, which can lead to human and labor trafficking, but also they lack heat worker protection. So since we're talking about climate change and extreme heat, they lack proper heat protections. There's scientific evidence indicating that water, shade, and rest can prevent heat-related mortality in farm workers. Yet most of them don't have this as a right. They have limited health insurance coverage. They have insufficient housing. As I mentioned, some of their housing that is employer provided doesn't have AC, or it's not a working AC unit. Some of them don't even have fans. And so they can be food insecure, which is really ironic, right? Because they harvest the food that we eat, yet they can be food insecure. And they also have insufficient transportation to move about freely. They have no commonplace benefits, so no sick leave, no paid vacation, no or health insurance that comes with most of our jobs that we're used to. And it's also a historically marginalized community. It's a targeted population, and if you've seen the news recently, you've also been aware that there's a lot of targeted immigration raids happening in some of the states with the largest farm worker communities. And so now that I've shared a little bit of the US farm worker community and a little bit of climate change, so let's tie it together. Climate change and health in the US farm workers. So farm workers face disproportionate health risks from climate change due to their outdoor work environment and social vulnerabilities. I'm going to talk a little bit about wildfires and then really dive deep into extreme heat. So for wildfires, it's an occupational hazard and that can lead to traumatic injuries because of the conditions of wildfires, that they are rapidly changing conditions. It has increased smoke exposure for farm workers. They are more exposed to PM 2.5 matter, which exposure to PM 2.5 is one of the leading global causes of morbidity and mortality. It is also documented that particles of PM 2.5 matter that come from wildfires is more harmful than other sources. They also have exposure to ash and then chemicals that have a reaction with the fires. And so all of this is exponentiated in this community. In California, a few years back, since California is one of the states with a lot of wildfires and the frequency and the severity of wildfires, there was an ag pass in California that allowed entry into evacuation zones for farm workers. Excuse me, for farm workers. So even though towns were being evacuated, mandatory evacuations, farm workers still, if they had the ag pass, they could come into the fields and continue working in agricultural labor, exposing them more into these hazards. Some of them didn't have adequate protective gear, and again, some of them had poor indoor air quality in employer provided housing. So the filtration wasn't there in their site of work, and neither was it in their housing. Some immediate symptoms from wildfire exposure are eye irritation, burning eyes, sore throat, coughing, sneezing, wheezing, chest tightness and difficulty breathing, headaches, fatigue, and dizziness. And it can also exacerbate pre-existing conditions like asthma. And then some long-term impacts are respiratory illnesses, lung damage, cardiovascular effects, and also mental health impacts. And so now to talk about extreme heat, which is the invisible climate disaster, and that's because we don't see the wreckage that's often left behind from other climate disasters like hurricanes or even wildfires. Extreme heat is invisible. So the Environmental Protection Agency attributes approximately 14,000 deaths of heat relate directly tied to heat related illness between 1979 and 2022. However, this number is likely more likely an underestimate since the criteria to determine heat related illness varies from state to state, and it's also very hard to attribute heat as a primary cause of death, especially among people with comorbidities. And as the days and nights are getting warmer, heat-related illnesses will be increasing. And because we're going to be seeing more heat-related illnesses, we do need to improve our surveillance infrastructure, not just in large hospital and health systems, but also in local community clinics and rural areas. We need to do better at tracking heat-related illnesses and then collecting that data too. So heat, extreme heat in the farm worker community in particular, heat-related mortality for farm workers is they are at 20 times increased risk to all civilian workers. And in terms of outdoor workers, which includes construction workers or landscape workers, they have a 35 time increased risk of heat mortality. So some immediate impacts are that they can have a heat-related illness, and heat-related illnesses can vary from heat rash to heat cramps, fainting or dizziness, heat exhaustion, and then heat stroke, which can be deadly. It can also sustain injuries due to fatigue. You know, when we're outside, the sun just drains us and it can impair our judgment. They can also have mental health distress and increased pesticide exposure. So farm workers are already exposed to a lot of chemicals in their work environment, but heat just intensifies the chemical compounds and the exposure to them. And so some long-term impacts of heat exposure are cardiovascular disease, cancer tied to pesticide, reproductive health, acute kidney disease, and there's more and more research that indicates extreme heat exposure in the farm worker community that could lead to acute kidney disease. And there's been studies done in Sri Lanka and also in Central America. And some contributing factors to their continuous exposure to extreme heat is, as I mentioned before, their piece pay rate, which is part of the economic insecurity. So it also incentivizes them to work long hours, to have 12-hour shift days, to not take breaks. It's also extraneous and extended outdoor work. Sometimes, especially when the climate varies, and in North Carolina, we experienced flooding a couple of weeks ago. And so I was supposed to do an outreach meeting with them, but we canceled it because it was projected that the next following days it was going to be raining heavily. And so they wanted to pack as much work as they could on that day. And so it's extended outdoor work. Um, they lack worker protections for heat protections in particular. They have inadequate access to water, shade, or rest. There is no guidelines that indicates that workers need to have access to these three things that have been proven to prevent deaths. So it's really up to the farm owner or the supervisor to provide these things, to allow them to take rest when they need to have some kind of shade for them that is appropriate and that would actually serve to cool their bodies, and that will have access to drinking water. They have a lack of healthcare access too. Sometimes there are conflicting priorities with that. Sometimes instead of paying money to be seen or for a prescription, they prefer to spend those resources elsewhere. or they, instead of taking the time off to be seen, they prefer to work those extra hours. And as I mentioned before, they have substandard housing, so it contributes to the extreme heat exposure. And there's also increased vulnerability in migrant and unauthorized workers in this community. And so overall, it's about systemic change for the farm worker community. It's about dignity and safety in the workplace, economic justice, basic human rights, when we talk about just having access to water, to shade, to breaks. And it's also a big topic of immigration. In terms of heat protections and worker rights, there are legal gaps in worker protections that there's conversations happening on the local level, state level, federal level, but nothing yet really solidified. And my next slide is more about which states do have heat protections. Water, shade, and rest, the three basic things to provide this community that can prevent. And also the importance of having a heat acclimatization plan. The deaths that have been documented, at least in North Carolina, several of them have happened shortly after arrival, which indicates that there is something to do with acclimatization and the importance of building up the heat strength for the workers. Also about exposure monitoring and how employers or supervisors measure the temperature. We're used to the heat index and our app, our weather app, when they tell us how hot it's going to be, it's usually based on the heat index. But when we are outdoors and we're doing strenuous work, athletes in the military, actually the military came up with the wet bulb glove temperature as a better way to monitor the impact of heat in the body. And then heat alert programs. There are some states that have heat alert programs. North Carolina just launched last year a heat alert program, but it's not very user friendly for the farm worker community because it's only done through email. And so the farm worker community would probably benefit more from a heat alert if it was done by text. Um, and also the importance of training and education about how to recognize symptoms on for heat-related illnesses, how to protect yourself from heat illness, and what to do in case of an emergency with one of your peers is feeling dizzy or faints in the middle of the field. And with that, also surveillance and record keeping. So as I mentioned, doing a better job of record keeping for reported heat-related illnesses, minor report heat-related illnesses that are just somebody feels dizzy, that should be reported. And of course, heat stroke. And then whistleblower protection. Some of the farm workers, when they see a peer or even themselves feeling sick or dizzy or they need a break, they don't do it because of this whole systematic problem with how labor is done, that there is incentives to not take rest, that there could be retaliation. You might, if you're an H-2A visa worker, you might not be called back the next season. And so then your financial livelihood is at stake. So you prefer not to say anything. So there should be whistleblower protections. And so some of the states that already have some kind of heat protection policy, whether it's indoor, like Minnesota is mostly focused on indoor workers, that doesn't apply to farm workers. Um, there are 7 states. Nevada was the last one. I believe they had the policies in April of this year. And North Carolina, we're still in discussions. A lot of community-based organizations and community and policymakers are in talks about how might there be a state level policy soon. Also, there are 2 states that have passed the opposite policies to prevent state level haven't they haven't so Texas and Florida have enacted state laws that effectively ban local governments from establishing their own heat protection for workers. So they want to fully rely on federal policies, which will take a longer time. And so the federal policies that are currently being discussed, there was an Asunción Valdivia Heat Illness and Fatality Prevention Act that was introduced years ago. It has yet to be passed. It was in 2023, it was referred to a committee and then it was pulled out. And so now some of the members of Congress are trying to reintroduce this bill. At the same time, there's a heat injury and illness prevention in outdoor and indoor work settings, which OSHA, which is the Occupational Safety and Health Administration, proposed this rule in 2024. It was open to the public to submit their comments in late 2024, and then just early July, so late June and early July, they had a public hearing. Well, I provided a testimony as a private citizen. And you can see that was a very interesting experience in terms of tying research to advocacy and policy work. And as you may have heard, the National Institute of Occupational Safety and Health, NIOSH, went through a large restructuring in April of 2025, where a lot of the programs were defunded and there was a huge shift in workplace oversight. So even with policies, there might not be enough people to actually implement these policies or track the implementation of the policies. So there's going to be a lot of relying on organizational change. So while we wait for policy, let's focus on organizational change. And so my study, Cuidad, it's has two main research questions. So I'm curious to find out what interventions exist to address increased heat-related illnesses in the farm worker community. So what's being done in farms? We know that water, shade, and rest, but how is it implemented? Does it mean that there's just a water jug in the middle of the field? Does that work? Is that what the community wants? So it's a two-part question. So what exists, and then what interventions does a community want or need? And so Cuidad, which stands for Cultivating Unified Interventions for the Development of Safe Agricultural Responses to Heat, and it's also a Spanish word which translates to take care of. The goals of this study is to describe the current intervention. So we want to see what exists to protect farm workers in the United States. And then to analyze the current knowledge, the attitudes, and the practice of extreme heat in North Carolina farm worker communities. So we're going to have a survey and we're going to deploy the survey across the different farm worker communities in the state. And we want to learn more about what they think, what they know, and what they would like for new intervention. So we're also going to supplement the surveys with in-depth interviews of growers and farm workers to gather information on their experiences with heat-related illnesses, any existing workplace interventions, and the feasibility of new interventions. And so the goal is to really hear both communities, the growers and the farm workers. I think it's really important to bring both groups, especially when one is going to do the implementing of the intervention and the other one will be benefiting from it. And so in the long term, also the growers will benefit, right? Because they will have a healthier workforce. And so co-designing a workplace intervention with the North Carolina grower and farm worker community, it's our ultimate goal for this study. And at the center of this study is community engagement. And this is a framework that I've been using for the study, a framework that I've been using in some of my other community engaged work, and one that I'd want to highlight with you. So it's the Assessing Community Engagement. It's a National Academy of Medicine framework that was published in 2022. And so it centers community engagement as co-equal partners built on trust, bi-directional learning, and it peddles as towards health equity through transformed systems for health. It also focuses on strengthened partnerships and alliances, on bidirectional learning, and on policy. So for me, the third pedal, that would be engaging in advocacy pedal. So another thing that why I really like this framework is because it uses elements of cultural humility, which mean that you are a lifelong learner. So even as researchers, when we enter communities and we try to do new research with new communities, we should go in as students, right? We want to be continuing learning, lifelong learners. And we also want to be aware of our own power and challenge power dynamics as we're talking to communities to be able to be there as true equal partners. And so I mentioned again, engaging in advocacy too. So it's uh, whatever topic that you are researching, that you are engaged in, that you're passionate about, it's not just doing research on it, but it's also being an advocate for true change. And so this has been a little bit of my community engagement process with the Cuidad study. So it came from the research question development came from some data informed about heat and the impact of heat in farm worker community, and then doing community outreach, entry into the community through a partnership. I was lucky to meet my point of contact with the North Carolina Farm Worker Health Program, which is an Office of Rural Health within the North Carolina Department of Health and Human Services office. And so through them, we've been able to offer informational sessions to community-based organizations and open it to the entire community that serves farm workers, and to see who wanted to partner with us. The first community that said yes was Piedmont Health, and so they've become our main and central collaborative partners in this effort. They are helping us with project acceptance from the community and participant recruitment. And then the goal is to co-design the intervention that will be community-led. And so the methods that we've used have been community-based participatory research and also human-centered design for the intervention phase. And so as we are engaging with the farm worker community, and I think this is true for any community that you work with, trust must be the foundation of the relationship, and acknowledging conflicting priorities, especially with, for example, the community that I work with, which is low income, and they have several other conflicting priorities in terms of having the luxury of worrying for something that could be long-term impact, like climate change, heat, especially if it's not immediate. It can feel as a luxury. So acknowledging their other conflicting priorities, that they are worried about their day-to-day livelihood and their economic stability. Also messaging, delivering the message in the urgency of this topic of climate change, of the impact of heat in their community, using stories, and better if they're local, because that's what they know. That's probably what they've heard about. And so the more you're able to communicate with something that resonates to the community, the more they'll be open to hearing you out. And be clear about your message, be clear about what you're trying to communicate. Sometimes, as academics, researchers, we get so close to the science that we don't know, we start speaking in jargon, and we just forget to communicate in ways that's important for everyone to understand. So although sometimes it is important to use jargon, be sure that you explain that, but try to stay away from it. And then focus on your goal and be clear about your goal. What do you hope to work on today? So when we talk about the impact of climate change on health, that can feel like a huge topic. Climate change, that's big, and understanding that they don't need to know the science behind all of these events. What causes a heat wave? What causes a hurricane? What causes the wildfires? So that's a lot of information, right? So just focus on your goal, have some background knowledge to be able to communicate or guide them to more resources if they're more interested in learning about the science behind that. But focus on your goal. What do you hope to work on? For example, heat safety. Okay, we'll talk about heat safety. Talk about ask questions. How have they felt during the latest heat wave? Did they notice any change? And so on. And then leave the conversation with hope. So again, climate change can feel daunting. It can feel big. It can feel like sometimes can we reverse it? What can we do about it? Like it can feel like um, it can feel powerless unless you talk about what's being done. And there's a lot of positive things that are being done. There's a lot of hope in it too. And invite them to be a part of the solutions with you and to regain some of that power and focusing on the little things that we can do together. And so what I am hoping to achieve with the Equidad study and the impact that I hope to have is one, to have enough data to pilot the study. So at the end of the study, we're going to have a toolkit with an intervention that was designed with the community for the community. And so we hope to be able to pilot this intervention in at least the farms of the growers that we're going to be working with and start there, figure out what works from the intervention, what doesn't, what needs to be tweaked, and then from there, disseminate it to a larger audience. And so results can also inform preventative measures against heat-related illnesses at an organizational level. So as we heard earlier, while we wait for state policy or federal policy, the changes that can happen now to prevent deaths in farm workers due to heat-related illnesses can lie at the farm level and a much lower a layer of responsibility. So, um, encouraging also the adoption of the intervention by both the farm workers and the growers, because if the intervention will include breaks, a big topic of discussion is, well, are they going to be paid breaks or not paid? And so if they're paid breaks, then we need to convince the growers that that is something that is cost effective, and if it's not paid, we need to convince the farm workers that that is something that is cost effective too. Because both groups have their own reasons for adopting these interventions or not. And then providing more information to growers and farm workers of existing intervention. So they might not be aware what's being done in California or what's being done in Florida to protect farm workers. And so getting the groups together, talking about these interventions that exist, and then hopefully coming up with an intervention that works for their farm, for their local context. And also to inform policy to expand heat worker protections to the agricultural sector. Even though the OSHA proposed rule was up for public hearing, we don't know when that might pass or what's really going to happen, especially with the current administration. But what we do know is that the more data that we get, the more research that's being done, that can help inform policies. So that's one good thing. And so I just want to mention this art. It's an artist, Narciso Martinez, that I follow, and I really, really love his art. He was a former farm worker, and so he uses um, boxes or paper bags from anything related to food or farms, and he paints portraits of farm workers. And so I also want to acknowledge my community partners, the North Carolina Farm Worker Health Program and Piedmont Health. Without my community partners, I wouldn't be able to do any of this. And so also to acknowledge my dissertation committee, Doctors Hayden Bosworth, Amy Cornelli, Leonor Corsino, and Kelly Taylor. And so for my conclusion, when you are thinking about a climate related disaster and how that ties to health, um, and then once you bring it closer to a community and you try to approach that to it with a certain community, think of it as a holistic approach. Think about it as everything that encompasses that community, how they might experience climate change, which is very different from all of us, which I can dare to say that all of us in this call can be a little bit privileged compared to some of the communities that we want to work with for health equity. It also recognizes historical injustices, it elevates local voices, and builds resilient systems. Not to say that the communities are not already resilient because they've had to be resilient since day one because there's no other option, but building resilient systems that work for them. And to center the community in the process. Whatever solution you are thinking about, you have to center the community and you have to let the community lead the solution. And that is it. Thank you very much. And
Thank you
any
so much.
questions?
Yeah, thank you so much, Elizabeth. That was a great presentation. I really appreciate you going into all aspects of it. It's kind of starting with the specifically farm workers and migrant farm workers, and then focusing on climate change, and then bringing it all together, especially in regards to your own project and the QuiDAR study. I would love to hear from any of the attendees. I know I saw in the chat, well, we have a wide audience today coming from a lot from the US and from North America, but several from across the globe as well. So I'd really love to hear from any of you if you have any experience working in similar projects, similar fields, and kind of questions that you might have. Or if you don't work in these fields, what sort of questions do you have for Elizabeth? So please um, raise your hands or send in the chat, and we'd love to hear from you. I do see one question from Jonathan in the chat already. It's a very interesting topic. What are some of the major challenges you faced during your research, and how did you overcome these challenges? And what approach did you use to reach farm workers from remote areas?
Yes, thank you for that question, Jonathan. Some of the major challenges, I would say, so I'm originally, so it was establishing that first connection with the farm worker community. So I am from California and I've done work with the farm worker community in California. When I moved to North Carolina for school, um, I was new not just to the community, but also new to this environment. I didn't know how hot it got. I didn't know how the seasons changed. So everything was new to me. And actually, the fact that I didn't know how hot it was led me to research heat in the farm worker community. So I just couldn't fathom working in the fields with heat. When I moved here, I thought I wanted to study wildfires in the farm worker community and the impact of wildfire smoke, but then that quickly shifted to heat. And so it was going out there. And I think when you do meaningful community engagement, it has to be genuine. And your curiosity for learning about the community has to be genuine because they can smell it. They can really they can tell when you're coming into the community just for research purposes and you're going to come collect data and leave. And so they can be more protective about their community. They can close their doors on you. And so have a genuine curiosity about the community, but also care about the community and start going to events, start learning about it, showing up, volunteering. That really buys a lot of trust and it has to be genuine again. Um, Challenges since the change of the administration has been on funding. So a lot of funding challenges working in climate change and also in a mostly migrant community. that was one of the biggest challenge. Right now, there's also a lot of fear in the farm worker community because of that, because of immigration raids. And so, if I had not done the legwork in the prior 2 years to gain the community trust, to work with the community, to truly share that I care, it would be very difficult to try to do this project now.
Great. Thank you for that response. I think, Abdullah, I see you have your hand up, and then we have a couple additional questions in the chat for after.
Yeah, thank you, Shanta. Thank you very much. Thank you, Elizabeth. It's really interesting topic. I am very happy to hear this expertise from you and this information. Actually, we work on the same population. I also work on farmers' health, but you focused on the heat-related impacts of climate change. I am working on the adaptation strategies of farmers with regard to climate change. So exactly, we have the same farmers have the same problems, the same challenges, and everywhere. But in Iraq, unfortunately, farmers are very marginalized population. They don't have any kind of support, literally, from the administrative uh, government, and so they struggle with the impact of climate change alone. You find farmers that everything they use to adapt to the climate change is made by themselves, and they work to manage these impacts and keep going and keep planting their crops and trees. So the last 2 months, I worked to collect data in the field, and I have a mixed method studies, so I have surveys and I made focus groups to gain and acquire their experience. Actually, with respect to the health health aspects of the vulnerabilities, we found that they maybe completely ignore this side, and they need to be taught how to protect themselves. And very, very little of the farmers say that they protect their health uh, when they face heat waves, and they mainly work in winter, so also they face the cold chills, and they mainly the farmers here products are wheat and crops like wheat mainly, so they seed in winter, so they face the cold chills when they plant, and they face the heat waves when they harvest their products. So this was something that was very interesting and really insightful. One of the points that I found contradicting some farmers that have a belief that climate change has positive impacts. I also found that they adopt very harmful adaptation strategies in their work, like burning the residue of their crops after harvesting, and polluting the environment, affecting the soil, the soil productivity, killing the micro living that live in the soil, and many points that each point related to and need a standalone study. So it's a rich environment that have many idea. I want to make studies about this.
Yeah.
So it's really interesting, and And I actually agree with you. Your project and your research was great, and I was happy to learn from these insights and information.
Thank you so much. And thank you for sharing about your experience with your research. Um,
Thank you so much.
I think it's really important. And I've been very curious about climate adaptations in agriculture in terms of farmers. What are they doing to change the way that they grow the food or to protect some of the crops when it's a heat wave or when there are floods, right? Which is going to impact our whole food system. And that's a different thing compared to what I'm more familiar with in terms of farm worker health. And it could be also farmer health, people who are harvesting and working in the fields. And so with smaller scale farms, you think, it's the same. Farmers and farm workers, the farmers are the ones who tend to their land. So a lot of the same thing applies. And I think what's really interesting, it's the long-term exposure to climate events or to chemicals, like you said, when they decide to burn excess crops or the impact on the soil. And so I assume that they might live near the farms or it's their property too. So they're more exposed to that. Um, so thank you for sharing that.
Thank you so much. When we talk about climate change, I believe that farmers or farm workers are the experts in this field. They feel and touch everything, every simple change. Everything is tangible for them. They are
Yeah.
really connected to the nature and they feel everything.
Mhm.
So it's a great, thank you so much.
Thank you, Abdullah, for sharing that. I think we only have a few minutes left, so let me read both Margaret and Jose's comments and questions, and then go ahead and tackle those responses as you think is best. So, first, from Margaret, she says, really glad to hear about your research. I'm curious, what is your experience and perspectives with working with the North Carolina Agricultural Extension agents during outreach efforts or as a partner to promote business adoption of better practices for heat exposure safety standards? And do you think there is trust in the community there? And then the second question from Jose is saying, again, excellent and insightful presentation. And do you think your research from Cuidar can be applied to other communities that are facing similar challenges globally?
Okay, thank you. And thanks for those questions. For Margaret, I have I've reached out to the North Carolina Agriculture Extension and I've had some meetings with them. They've been really helpful in helping me uh, figure out how to communicate with growers because the language can be different from farm workers to the growers and how we communicate about heat or climate change, whether we want to use the word climate change or not. So that's been very helpful. We don't want to uh, have people completely filter our message and block us because we're saying climate change. So I want to be very careful about that. And that's what the NC Agriculture Extension, my points of contact there have helped me and figure that out. In terms of recruiting growers, they also provided some insightful information on how to recruit growers. And I've been working with Carolina East Access East. Um, it's a Access East, and they work with a lot of growers who might be a little bit more motivated to be a part of this study. And so that will be a unique group to help get this and kick this off and develop the intervention and pilot the interventions because they're already working on climate change, they're working or heat exposure, working on interventions with farm workers. And so that wouldn't be too much of a lift in terms of convincing growers to join this study. Um, and in terms of trust in the community, do you mean the community of growers?
I think I mean, yeah, both the growers and also potentially the farm workers doing outreach with farm workers through extension.
Yeah, so for the outreach for farm workers, I haven't done it through extension. I've gone mostly with my CBOs with Piedmont Health. I've worked with NC Fields and in talks with El Futuro es Nuestro. So hoping to do that through the CBOs, which I think they have maybe a bit more trust within the community. And so with growers, I'm hoping to be able to recruit all of my growers from the CBO that already works with them. If not, I may have to come back to agriculture extension and figure out some help from there. Oh, you're muted. Sorry.
I say awesome. Thank you so much for the answer. It's good to know.
Oh, and then the question from Jose to other
Yes.
communities.
Yes, if you think your research from Quidar can be applied to other communities that are facing similar challenges globally.
Yes, I think that it can be applied to other communities, especially in rural communities. And as Abdullah mentioned with small scale farmers, that it also impacts them and their health. However, I think the US has a very unique relationship with agricultural labor, that there are some things that will need to be taken into account in terms of trust in the community and historical legacies of the marginalized group and targeted group. But I think the intervention itself can definitely be translated to other contexts. Thank you for the question.
Fantastic. Thank you so much all for the questions, and thank you, Elizabeth, for those responses. I think just reading through the comments and everything in the chat, it was a very, very insightful presentation. A lot of people resonated with parts of it, if not all of it, particularly community engagement or working specifically with farm workers and ag. So thank you so much again. It was fantastic to have you with us today. And we look forward to staying in touch. And please do keep an eye out, everyone here. The session is recorded and will be shared. So please share with your networks and anyone you think might be interested. Thank you again.
Thanks. Thanks for the invite.